Seniors live at home, and these are challenging times for seniors living at home. We have throughout BC, and we have a network of organizations and volunteers in community that support seniors in community living at home, and those networks have been stretched in recent a committee that has done extraordinary and rapid work to put together a response to assist seniors living in community, and also to harness in the safest way possible the enormous desire of British Columbians to support their neighbors, their friends, their communities. I get contacted every day by people who want to help and who are engaged in helping, and that is an inspiring thing in difficult times. So last week I convened a group co-chaired by Isobel Mackenzie, by Terry Collins, an outstanding public servant in the Ministry of Health, and involved 5 members of the legislature: Ronna Ray Leonard, who's the Parliamentary Secretary for Seniors; Shirley Bond, MLA from Prince George and former Deputy Premier; Janet Rutledge, an MLA from an NDP MLA, a government MLA from Burnaby; John Yap, an MLA from Richmond; and the Green Party House Leader, Sonia Furstenau, with the idea of developing together, under the guidance of Isobel Mackenzie, a program that would help seniors who are living at home, seniors in community. On Monday, as all of you know, in her update, her economic statement, Finance Minister Carol James announced there would be $50 million in new support for Better at Home programs for the United Way, whose Better at Home program engages 68 community organizations across BC, 24 of which are involved and will be involved in COVID response. And so this work that people came together and have done is extraordinary work, and Isobel Mackenzie will be speaking to it in a minute, but it reflects, I think, the commitment of all people, and I want to thank all 5 of the MLAs, the team at the Ministry of Health, and in particular Isobel, for their involvement, for the speed in which they've moved here to provide some additional supports to address issues of isolation that occur. Because as we all know, people often, especially seniors, need to stay home to stay safe. But they need support in doing that. We can't let social distancing become isolation. And that is part of what we're trying to achieve today. So with that, with the details of the program, and just to put it in context, the person who will be in charge, Isobel Mackenzie; the other person in charge, Terry Collins. The board of directors will be the MLAs from all parties and from many regions of the province. We'll be announcing our program, and this program to assist seniors living in community. I'd like to welcome Isobel.
Thank you very much, Minister Dix. I'm Isobel Mackenzie, Seniors Advocate for the province of British Columbia. As you know, on March 8th, 2020, BC declared a public health emergency due to the COVID-19 outbreak. And I know that people across British Columbia are anxious and they're worried about their health, about the health of their loved ones, and about what the future holds. Seniors are especially worried about COVID-19. It is particularly serious for the elderly people and those with underlying health conditions. The Provincial Health Officer, Dr. Bonnie Henry, is asking all British Columbians to stay home, to self-isolate as much as possible, and when it is necessary to go out for essential activities, to stay at least 6 feet away from other people, and to not go out at all, even for necessities, if you are feeling at all unwell. These measures are vitally important as we try to protect our vulnerable seniors. As Dr. Henry reminds us, it's not just about you getting sick. It's about bringing the infection home to your family. And this could include your mom, your dad, your grandma, your grandpa. Most of us are following Dr. Henry's advice, and seniors want to do the right thing and want to stay at home, but they're going to need our help in order to do this. Within a matter of weeks, things have changed drastically for all of us. They continue to change as we implement more safety measures each day to protect all British Columbians. And it's clear COVID-19 will not be with us forever, but it will be with us for some time. If we put ourselves in the shoes of a senior, we can begin to understand the additional challenges older adults will face in responding to COVID-19. Seniors are most at risk of COVID-19 and the seriousness of this virus, and they are frankly afraid that if they get it, they will die. They are also more likely to have complicated health issues, more so than most of us, and they're worried about whether they'll receive the care for those health issues while we're focused on the battle with COVID-19. Many seniors rely on friends or family, neighbors, to visit them, shop for them, pick up their medications, make them some meals, and drive them to medical appointments. This support network that provides many of the essentials that allow seniors to continue to live independently in their own homes has been strained by the COVID-19 restrictions. And seniors are overwhelmingly more likely to live alone. And they are less likely to be plugged into the social networks of FaceTime, Skype, and Zoom. And that's why we are here today. As Minister Dix has spoken of, I've been working with the Ministry of Health, my colleague and co-chair Terry Collins, and an all-party legislative committee of MLAs on ideas of how we can better support seniors during this pandemic. While we know there are many seniors who are at added risk for COVID-19, we have also seen an amazing outpouring of community support as it becomes clear we're all concerned about the elderly in our communities. All over this province, every hour of every day, people are stepping up and reaching out to the seniors they know. They're offering to get their groceries. They're taking time to give them a call. They're dropping off some dinner. Many businesses are showing they too are concerned and are responding with dedicated shopping times and increased delivery capacity. To all of you, I say most profoundly, thank you, and keep on doing what you're doing. However, my office, as well as MLA offices throughout the province and other offices, are being flooded with calls of people who want to help seniors. We're also getting calls from seniors and worried family members outside the province and in different communities from where their mom and dad live about how they can cope and what help there might be. Connecting the people who want to help with the people who need help is going to be a key strategy in meeting the needs of seniors in the coming weeks. And together we have come up with a way to do this. The government has provided the necessary funds to expand BC 211. It's a 3-digit number, 211. You can now call it from anywhere in the province and you will reach a live operator. It's backed up by a website, BC 211. And they will manage calls from people who want to help, as well as people who need help. So the message is simple. Wherever you live in BC, if you want to help seniors with virtual visits, picking up and delivering some groceries, picking up and delivering some medications, maybe dropping off a meal or two, call 211 or visit the website. And we'll try to match you up with a senior in your community who needs help. If you are a senior or the family member of a senior who needs help, getting groceries, getting their medications, staying connected, call 211 or visit the website. And we'll try to match you up with a volunteer or some kind of service in your community that will provide the help you need. In addition to the expansion of BC 211, the government has also increased funding to the Better at Home program significantly. And it's delivered by 68 different community agencies all across BC. They're getting additional funding to ensure that the core Better at Home services can meet the COVID-19 challenge, and 24 of these agencies have been designated as COVID response agencies, and they will be resourced to meet the new demand from the increased number of volunteer and client screening and matching processes that will happen. They will cover all of British Columbia. So after receiving a referral from BC 211, Better at Home will work to match seniors with volunteers and to support them through the COVID-19 crisis. Services available right now to seniors include meal delivery, help with cooking, delivery of groceries and medicines, wellness checks, calls, and visits. These supports will go a long way in helping seniors stay safe at home and to relieve the anxiety and worry that many seniors are feeling. My message to BC seniors is simple. Please do not be afraid, but please stay home and let us help. We want to help. Your kids, your grandkids, your community, every one of your elected officials at every level of government want you to be safe, and we are here to make sure that you're supported. Please, let us pick up your groceries. Please, let us get your medications. Please, let us give you a call each day. Please, let us know if there's something you need. Let us drop off dinner. If you're one of the tens of thousands of seniors who are normally the ones volunteering and helping, give 211 a call. You can help out with virtual visits, virtual calls. But please, now is not the time to be out and about in your community. You can help us all by letting us help you. It's not forever, it's for now. If you need help, call 211. If you can help, call 211. I would also ask that in showing our kindness to one another, we also show a little patience as we roll out this program. Significant capacity has been added, but this is uncharted territory. If you can use the website, please do so, and know that we are monitoring call volumes and will try to make necessary adjustments. We simply don't have the luxury of time that is necessary for perfection. And now I'll turn it back to Minister Dix, or I am open to any questions.
Just take questions. Yeah.
Okay. So as a reminder to callers on the phone, you can press *1 to enter the queue. Due to the volume of questions, please limit yourselves to one question per person, and a reminder to all to unmute your phones. You will not be audible until we patch you through. So we will start with Tom Fletcher from the Black Press. Go ahead, Tom. Okay, we're going to move on to Brishti Basu from Victoria Buzz. Go ahead. Okay, Richard Zisman from Global.
So I'm just wondering, Isobel and Minister Dix, what sort of numbers are we expecting here? Like, how many seniors are we talking about that could receive this service, and what sort of estimates, if any, are there in terms of the number of people you expect to want to get involved as volunteers?
Well, we're not sure, Richard. These are uncharted waters, but to give a sense of perspective, we're anticipating adding capacity to accept probably about the equivalent of 100,000 calls a year. So we're looking at having that amount of activity each day. A lot of people are already helping people out there. This is for, I would say, in the thousands of calls that have been received of people who are looking for a way to help. And again, in terms of the seniors that are needing help, I think we will find that as we look to things like picking up groceries and it becomes more difficult to get the delivery service because demand is rising, I think we'll see probably several thousands of clients that can be helped by this.
Okay, next question comes from Moira Witten from the CHEK. Go ahead.
Good afternoon, Ms. Mackenzie. Thank you so much for your briefing. I'm wondering how this applies for seniors with language barriers who may have difficulty accessing the 211 services. Is there translation or other assistance available to make that easier?
Yes, 211 currently has the capacity, and that will continue to deal with in the dozens of different types of languages. So a person who's not able to speak language or not able to speak English, pardon me, will find that translation available. And also 2 of the COVID responder United Way agencies involved are able to offer multilingual services. So they'll be, if they want to volunteer, they'll be able to talk to somebody in their language, and they will be matched, obviously, to somebody who also speaks only that language who needs those services.
Wonderful. Next question comes from Georgie Smith from CBC. Go ahead.
Hello, I just have a question about the Lynn Valley Care Centre for Minister Dix. What have we learnt from the way the virus has spread through the centre in particular, and how can you ensure families at other long-term care facilities, their loved ones won't face similar problems
Georgie,
if COVID does turn up?
I'll look forward to responding to all the other questions at 3 o'clock. We're answering questions around this particular program on this call, but I'll be back within an hour and a half to answer that question and many others. And obviously the people at Lynn Valley, we've already seen significant support provided to that care home. It's obviously a very serious situation, but we'll be happy to respond to that question at 3 o'clock.
Okay, Mike Hager from the Globe and Mail.
Hi there. Thanks for holding an availability. I appreciate this is about seniors at home, but Ms. Mackenzie, you're here now, and I was just hoping for your thoughts on how Lynn Valley, which by all accounts from your office and your reporting appeared to be above average in terms of long-term care, how its outbreak was poorly handled and has become so deadly. What does that say about the wider sector and its preparedness for this virus? Thank you.
Well, I think once we have gotten through this pandemic, we will be looking back at a lot of things and how prepared we thought we were versus how prepared we were, and whether our current processes around monitoring are sufficiently robust. And I think right now our focus has to be on trying to contain any future outbreaks that may be happening. And I think that there's a lot of work going on right now to try and ensure that we limit as much as possible any repeats of what we have seen at care homes like Lynn Valley.
Next question is from Lisa Cordesco from CHLY. Go ahead, please.
Thank you. Could you please comment on the fact that with this 211 service, you will now be relying on people volunteering to help seniors as opposed to paid care workers?
Lisa, most of these services are services that volunteers to a great extent already provide out in the community. So this is around going and doing grocery shopping for people, now it will be virtual visiting versus friendly visits. And we have that happening in a lot of communities already in British Columbia through not just Better at Home, but a lot of community agencies offer a variety of these programs. What I would call the more professional services where you're doing personal care and those types of activities, that's not what this program is for. This is really to address those seniors who might be getting help right now from family, friends, and what I would call a more informal network. And that network is strained because those folks are self-isolating or feeling unwell or concerned about going into the grocery store themselves. And we have a new group of people, many of whom are much younger, many because they aren't able to do the job they normally do, who want to reach out and help. And it's about matching that group together. It's not substituting with volunteers work that is currently done by paid staff.
Tyler Olson, Abbotsford News.
Hi. Hi, thanks. I know most of these seniors you're talking about are just the broad category of seniors who live in the community already, but there used to be more than 1,000 seniors in hospital waiting for spaces in the community. I imagine some of these are now home. Can you tell me do you have numbers on how many of those seniors, ALC patients, are at home versus have been placed in care homes or other locations?
I'm going to turn that over to Minister Dix to answer.
As you know, in the last number of weeks, in the last couple of weeks, we've done a major effort to create space in acute care hospitals, and you're seeing that. And I'll be speaking to that specifically, Tyler, and at 3 o'clock at that briefing. This briefing's about the specific program, but I would say this, that the significant steps that have been taken about ensuring that we have enough space and enough beds in hospitals to deal with the potential surge of COVID-19 patients has involved, as you know, the cancellation of elective surgeries, or what are better, I think more appropriately called scheduled surgeries. It has involved steps like acquiring and finding spaces in care for seniors who are ALC patients, as you noted. So this is not, generally speaking, the group of people that's being addressed in this program. There are lots of seniors who live at home now who receive support or engage with community groups, and a lot of what we usually do, including the significant expansion in adult day programs and other things, are canceled right now. So providing more links and more support to those seniors so we can live through this, so that we can continue to all stay at home when we need to stay at home, I think is an important step and an important program. So that's what we're addressing here. You're quite right. There are significant issues about ALC patients or what's called alternative level of care patients, or patients who don't necessarily need to be in acute care but are there because they haven't got the appropriate care elsewhere yet. Those issues are obviously a key part of what we're doing. Just as one example, in Victoria, a care home that has yet to open has been set aside for exactly that purpose.
Next question comes from Nadia Janis from CBC. Go ahead.
Hi. This question is for Ms. Mackenzie. You warned about the inherent conflict between the need to make money at for-profit long-term care homes and the provision of services to BC's most vulnerable seniors. How do you see those concerns playing out now that those homes are dealing with COVID-19?
I think when we are through COVID-19, we are going to look back and we are going to see some fault lines that expose themselves very vividly. And I think that there will be a spirit to address those. And I think for the moment, my energy and attention is on making sure that we have the plan in place that is going to reduce and mitigate as much as possible the risks that our seniors are at in our care homes. And I think there is a lot of work being done by a lot of people right now to try and address response for COVID-19. And I think when this is over, we probably will be looking at how we are going to, in the future, not find ourselves with some of the frustrations that we have at the moment. But I'll leave it there.
Next question is from Simran Singh from the Daily Hive. Go ahead. Okay, we're moving on to Michael Rodriguez from the Black Press.
Hi there. Is this 211 service available to seniors in care homes as well? If not, what's being done for them in the realm of virtual visiting?
Very good question. Yes, it would be available to residents in a care home. Many of them have telephones and access to telephones, and if they didn't, I would expect that the staff in the care home would facilitate that, and they would be able to call and be matched up with somebody who would have some virtual visits with them. Yes, very much so. And I'll turn, Minister Dix.
Just to add that, yes, it would be. Obviously, every care home right now is dealing with exactly the situation of social isolation you described, because visits to care homes are being very strictly limited right now across BC, across care homes, and obviously care providers are looking for ways to support in this period of what can be a period of real isolation, where people really count on family visits and so on. There's dramatically less of that, and that's a challenge for everybody who works in care homes everywhere in BC. So a lot of that part of it has happened already, but yes, potentially in terms of the calling and supports that would be available, although obviously all care homes right now are under very strict control, as you would expect.
Next, we have Amy Smart from the Canadian Press. Go ahead, Amy.
Hi, I'm wondering, we know seniors are often considered a vulnerable population. What kind of screening are you doing for volunteers who might show up with groceries at their home when they're alone?
Thanks, Amy. The process for screening volunteers is a process that's already in place in the community. And so we've expedited some of the processes, particularly around the criminal record check. So everybody will have to have a criminal record check. We have made arrangements with attorney generals to expedite these, and they do have the capacity for virtual identity confirmation. So people will be going through that type of screening. They will also be receiving materials from public health on safe practices, and they will also all be asked to go through the COVID-19 self-assessment that is on the web site at the moment. Most of these services will not probably have direct contact with the senior, but they are going to get to know where these people live and who they are, and will be picking up their groceries and medications. So screening is important, and the provision is there for that, and it's the same type of screening we already do in the community to ensure that we're protecting the vulnerability of the people who are receiving the services from a volunteer.
Next question comes from Fran Yanor from The Go.
Hello, Minister Dix and Ms. Mackenzie. Ms. Mackenzie, I just wondered, rural areas have a tradition of strong volunteerism, and I wondered if you could speak to some of the challenges and strengths maybe that the 211 group has found in trying to roll this out in the rural areas, particularly the north.
Well, one of the benefits of this is that 211 will now reach the north. So 211 was only available in the Lower Mainland, and then in the last couple of years over on Vancouver Island. So Interior and the north were not able to use it. Now they can, and it's been tested and it works. So that's a good thing. There will be the access through the phone. There are a number of community agencies throughout the north, and they will receive the resources they need in order to hopefully meet the needs of the seniors. In the north, there are going to be some additional challenges. Certainly the distances that people might have to drive to get somebody's groceries and drop them off are going to be significant. And some of the connectivity, the sort of the IT connectivity is not as strong in certain communities as we would like it to be. But as you've identified, people who live in rural parts of British Columbia in the north are resilient, and they cope in a variety of things with weather-related isolation, and are perhaps a little bit more prepared in some ways for dealing with this. But there are certainly some additional challenges. But the benefit now is they can call 211. And I am very, very hopeful that that is a legacy that will continue and be one of what may be a few silver linings that come out of this.
Great. Next question comes from Scott Brooks with Moose FM. Go ahead, Scott.
Yes. Hi. I was just wondering, how much specifically was put towards funding, like in terms of funding to expand the 211 service and the Better at Home service?
You saw the announcement on Monday, Scott, and it's the money was $50 million.
Okay, we have time for a couple more questions. We're going to go to Colton Davies with CHNL.
Hi, Ms. Mackenzie. Sorry. Can this 211 service, just to be clear, can it help people with banking as well? I ask because we've heard from some seniors around here in the Kamloops area who are concerned when it comes to paying some bills in particular and confused about limited hours at banks, don't have internet at home, and are trying to stay home and also don't know how to use an ATM if they were to go when the bank's closed. Thank you.
So the short answer is they might be able to. So BC 211 is a very robust system. When you call 211 and you get the operator, this is just one piece. This has been an additional piece we've added to it. They have at their fingertips a repository of information. They have something like 8,000 different agencies and conduits to things throughout British Columbia. And so it is possible that they will be able to troubleshoot with the person phoning to be able to find what it is they need to find to deal with some of these issues. And it may be that there's a 1-800 number or website or somebody else that's dealing with that, and the 211 operator will be able to direct them to that.
And our last question today comes from Shannon Waters with BC Today.
Hi. That message is so weird. Hi, Ms. Mackenzie. I am wondering about a poll that we saw that came out earlier this week that suggested that older men in particular are least concerned about COVID-19. And there's also some data that's come out previously to suggest that men are less likely to reach out for help, for community resources. Do you have a specific message for what could be a particularly vulnerable population that is not likely to try and access resources, or not as likely as others?
Yes, my message is let us help. And let us help because if you care about your son or your daughter or your grandkids, let us help. We want you to be healthy. And don't be stoic about this. And don't be proud about this. It's not forever. We want to help. Please let us help. It's how you will help us help you. And it's not an insignificant hurdle, Shannon. Certainly in my years in community home care, this is not new, this resistance to help. This is a time-limited phenomenon that we have here with COVID-19. And so I'm asking just for this little bit of time, please don't be so stubborn, and please let us help.
Wonderful. I think that's it for today. Thank you very much.
Thank you. There you go.